Hello, welcome. Welcome in, everybody. We're going to get this going in just a couple moments. I hope everybody is doing well. I hope everybody's driving safely. We're going to get this thing rolling in just a moment here. Hop in the chat and say something for me if you're there. We're excited about today. I've got my tea with me, as you can see. I want to know what kind of tea y'all have today. Drop something in the comments. Let me know what kind of tea you have. Hope everybody is driving safe and almost to their destinations. I hope you all are excited about what this week is going to bring. This is Monday, another opportunity. And somebody said something brilliant to me the other day. They said, today is the beginning of the rest of my life. That starts right now. So if you've got a case of the Mondays, take advantage of it. Okay, I see peach lemon, raspberry tea. Awesome. All right, welcome in, folks. Welcome back to Tea Talk, a comfortable place for a health dialogue. Sponsored and brought to you by In Harmony Wellness Clinic, personalized, holistic, and virtual care. I do want to remind you, any information that we do share on this stream today is not meant to be used for medical advice. This is surely and purely for educational purposes. And so with that said, welcome in once again. I'm Dr. Cooper. I'm going to go ahead and tee this thing off. So today's tea that I have right here is called chamomile tea or chamomile, depending on how fancy you are. Chamomile is fantastic for a lot of different reasons. One, it's really good for relaxation. It's good for calming, but also it's good for blood pressure. It's also good for blood sugar and cholesterol. So most of us could really benefit from having this in our kitchen and making sure that we have this in our bodies. And so I appreciate you hopping on with me and having a brief moment of tea time. We're going to dig in a little bit deeper into this thing. My guest today is somebody that I am super, super proud of. I hold her very dear to my heart. Mrs. Orjanette Cooper Bryant is a board certified nurse practitioner. She provides longevity and anti-aging focused care. She supports as well as introduces weight reduction management. And she helps boost immunity by the use of injections. So, Mrs. Orjanette Cooper Bryant, why don't you say something to us? How you doing today?
Well, hello, everybody. I got my mint tea right here. Don't you like that?
Right.
That's pretty impressive. But yes,
Well,
hello, everybody.
we've got a great show for you guys today. Mrs. Orjanette Cooper Bryant is an absolute professional in her field. She's going to help us break down some of the things that we've been wondering about. She's even going to discover some of the things that we didn't even know was available to us. And so this is very exciting. We're going to jump right in. Mrs. Bryant, can I call you mom?
Yes.
Okay, I'm going to call you mom. So, mom, can you tell us the name of your organization and who you serve and where?
Okay. The name of my organization is called Vita Lift Infusion. I serve the population, mostly the elderly population, but anyone over the age of 20. Okay. And some of the services that I provide is weight management, immune boosting and support, anti-aging care, longevity focused care, and beauty. you know, um, I support hangover solutions. So if someone's out there drinking and they need a little cocktail, I'll give them the cocktail. Also, if you have autoimmune disorders, I have solutions for you as well. Performance enhancement. So if you're a sports person, you're out there running, losing all that you're sweating, you're losing your electrolytes, you want to boost, call me. I can get you some support and give you some amino acids that are essential at your body repairing. So I have a lot of solutions depending on what the need is. And by the way, Dr. Cooper, I what makes me a little different from your average immune vitamin infusion is that I do a medical intake. I really look at your medical condition and your needs, and I try to hone into what is very important to you to support your medical condition and needs and support recovery. All the vitamins go through the bloodstream, so they do support the mitochondria and help with new cell development in the DNA.
Awesome. That's fantastic. I know that whoever is there, whoever is listening, they can use exactly what you're describing. In what area and who do you serve mostly?
So, lately I've been doing more of the weight management clinic because a lot of times people have a hard time with the idea of transitioning and losing weight. First it comes here neurologically, those neurotransmissions that occur in the brain, we're like, I don't want to do it. We have stress, we have anxiety, we have all these fears about weight reduction. And sometimes we don't stick to the diet or to the plan. So, what we do is we do a very comprehensive approach with that. We talk to you about what you're eating, we talk to you about how you're exercising. We give you injectables, simple B complex with methionine, inositol, and choline. The MIC is what I call like Mickey Mouse. No, methionine is really great, but I don't give it to everybody because it does have a little sulfur base in it. So, if you have an allergy, I assess for that allergy first. But the methionine, the inositol, and the choline together reduces your sugar, your cholesterol, your homocysteine level, and it actually helps reduce strokes and heart attack. So this is where that longevity focused care comes in. So I really love, love, love to support you on that longevity focus. So people look at it, they say, well, my B12 level is up, it's over 2000, you take blood tests, you look at it and we're like, okay, yeah, but you just pee it out, no big deal. However, what you got to start to think about is what is really truly going on in that mitochondria and in the brain. A lot of people tell me instantly after a shot, I felt great. I was able to sleep. I had so much energy. It changes the dynamics of your metabolism because you do understand once we hit past 40, we lose some of those essentials in the gut that help us with neurotransmission, with cognitive ability, with our metabolism. We lose a lot of that. So bringing it back into your system, this is what I do. I give you a simple little shot, boom, get you started. You may or may not know the difference. A lot of people tell me they do. They get weight reduction. So we do a lot to help support our clients.
Great. Fantastic. And looks like Miss Nikki McCrae asked us a question, and I do believe you answered it with some of the fantastic things in your products that you offer. And you've already indicated some of its benefits as well. Now, for the person who's maybe never heard of any of this, what we're describing before, could you explain to us, Miss Cooper Bryant, what IV hydration is?
Yes, I can. First of all, I want to kind of give a little history background. I've been in the medical field for 27, 28 years now. Can you believe that? You was a baby when I graduated. Wow. Anyways, I've been in the field for so long and I worked in the emergency room and up in Jacksonville at St. Vincent's Hospital, the people would get drunk, have hangovers. They'd be like really high as a kite sometimes. They come in, pretty much we put them in a room, let them sleep it off. Now, We also gave them a boost of thiamine, the B complex, the yellow, we call it the banana bag. That's
Mhm.
the recovery blend. So we give them that so that they can get over the hangover quickly. And as you probably have heard, you give them some nausea medicine, some Zofran, and give them a little Toradol help with the headaches so they don't have that hangover in the morning. So this is really good. It's a quick, simple fix. It does help support you. I do highly recommend, and somebody said, who are the people you serve? Well, people, I'm gonna give you an example because some people who work very hard, like business people, lawyers, people who are at the nightclub, students who try to study for a test, these people are ideal candidates to get an infusion. People who have autoimmune disorders are very good at getting, they can get these infusions and get a little bit of boost. It really helps them a lot. Um, Gastric bypass. Don't forget, they have to go on vitamins for life. So sometimes they may be just having a sick day, not feeling well. Give them a boost of vitamins with vitamin C, zinc, B complex, glutathione, zinc. You give them that, it helps support them, and they are actually able to take their PO vitamins and do pretty well. Now, I don't ever recommend that anybody stop doing PO vitamins. I recommend them go together, okay?
Mhm.
Because it's very important.
Good, good, excellent. And you mentioned something that I do notice personally in clinical practice is that there's certain populations that just simply do not absorb vitamins very well in their foods based on some of the things that you indicated. They can have bypass, they can have other malabsorption conditions
Yes.
that make it very difficult for them to simply absorb good foods. And they're eating all of the right things. They're
Yes.
exercising. They're doing all of the things that they believe to be, fantastic for their longevity. And there's a lot of them who just need an extra boost and who need to get over the hump. And it sounds like what you're describing is fantastic for that population and group of people as well. We also got another question here in the comments from Mrs.
I want to say something about you said the good gut health.
Mhm,
People with GERD,
mhm,
they should get an infusion. Honestly, they don't think
absolutely.
about it, but they really should get an infusion. People with gastroparesis, the ones that have diabetes and they're just always constantly having problems absorbing, they should come in and get a boost every now and then. Go ahead and ask the question. I'm
That's
sorry.
that's absolutely right. And if you are currently watching us right now and you feel like what the information that you're getting from Mrs. Cooper Bryant is fantastic information, like I know it is, please do share this with somebody. Please ask somebody to hop on while we still have her here and still getting expertise from her. In addition to that, if you see us on YouTube right now, if you like to continue getting good, powerful information like this, at home from the comfort of where you are with no copay, please do like and subscribe us here on YouTube. That's hit the like button, hit the subscribe button, and I'm sure that you'll continually get good, beneficial information like this. So I want to answer one of the questions that we got here recently. Now, one of these questions is from Mrs. Oslin, and it says, "When is the best time to start infusion? Can younger people do it as well?"
Yes. Okay. So, like I said, I would probably start thinking in terms of 20 plus. Honestly, the 20-year-olds don't quite need as much vitamins unless something has happened to them. Maybe they've been doing a sports run and they just need some essentials come back in their body from sweating. They get dehydrated, sun poison. The younger ones don't need it as much, but if you do have mental problems like anxiety, depression, I definitely would like for you to come in and see me because we do help with neurotransmission with the B complexes. Um, People in the age of 40s and up, you really should start thinking about beginning your vitamin regimen because that's when you don't get it in your diet. So it's very important to start thinking in terms of longevity. How am I going to live a long, healthy life, free of medical conditions?
Yes, absolutely. And, for the listener, if you haven't noticed, a great deal of us are spending our lives trying to manage conditions. And
Yeah.
Not enough of us are spending our lives trying to prevent conditions and maintain on the good side of health. Well, the good news is on either side, there's some help for you. Whether
That's
it's changing your diet, whether it's going the extra step and getting exactly what Mrs. Cooper Bryant is describing to us, there is help for you. If you're still on this planet, there's still a lot that we can do about your condition progressively. And I want to encourage you to continue to progress. I want to answer another one of these questions here before we shift gears and talk anti aging.
okay.
Another fantastic question here from Miss Nikki says, can you maintain your regimen of vitamins on a daily basis, even though you're doing IV hydration?
Yes, you can. And what I recommend, if you, I go by case basis, and I look at your medical condition and what your needs are and what you're going through and see what your goals are. And what we come up usually is probably once to twice a month. I tell you, I do it. I pretty much get an infusion probably once a month now. And let me tell you that the way I feel, because I'm very low on my water intake. So that hydration is so critically important for me. If you think about water and hydration, it's an oxygen and a hydrogen molecule. So if you put that in your body, it helps with your hair growth, your skin. Collagen helps support you with collagen intake, everything. So water is so extremely important for your kidney function, for your organs. As a matter of fact, my intake, I do a medical screening to determine if you're in kidney failure, congestive heart failure, or have any other fluid balance problem. And those are not typically candidates for the infusions. However, I do have injectable solutions that will help. I can give you a B12 complex of vitamin D, zinc, and glutathione, which is a beauty glow. You know about the glutathione, right, Dana? The
Yes, I do.
antioxidant. Okay. Yeah. And so we have some different options that really support what you're doing. And by the way, Nikki did ask that question. We think that we can take the pills at the Walmart, $4 and $5 pills, and they're going to absorb. Well, if you get less than 25% absorption with that and you pee it out. So typically, think about it. As soon as you go to the bathroom, you see all the yellow in the, in the toilet. So you got rid of it. You didn't absorb it. So it really is a good idea to do an infusion to help support it, to bring it in there to molecular level. And that way, when you're taking the vitamins, you absorb it a little bit better.
That is fantastic. So, once again, great information. We're going to shift gears a little bit right now, and we're going to talk a little bit about aging.
Okay.
Many of us know somebody who seems to be aging at a different rate than everybody else.
Yeah.
Many of us know somebody who seem to be aging backwards. Maybe they've had conditions and they seem to be going in the opposite direction as everybody else, and vice versa. What we want to know is a little bit about the aging process, and it appears that you might be the expert to give us the information we need. Now, why is it, Mrs. Cooper Bryant, that some people seem to age differently from others?
Okay, I think you know this, and epigenesis is a big thing. Our environment, hereditary factors, medical conditions, autoimmune disorders. I mean, diabetes is autoimmune. Things that we do, we abuse our body,
Mm-hmm.
smoking cigarettes, alcohol, you name it. Anything that we use in excess can actually cause some damage to our body. Even vitamins. If you overindulge with vitamins, you can actually mess your system up. So you have to be very mindful of everything that you do and be in tune with your body.
Mm-hmm.
Now, disease prevention is important to me. You know, I focus on primary prevention, secondary, and tertiary. Okay, tertiary, you already have the disease process. But the thing is, how do we prevent that diabetes from turning into an amputation or kidney failure or some blindness? So you have to think about the aging process and what you're doing. Abuse causes a lot of the damage that we see on our body. If you're not eating properly and you're not exercising and you're going to McDonald's eating the wrong thing with all the nitrates and all this stuff in you're loading your body with the wrong stuff and it will bite you in the butt. I promise you. So this is why I stress to, and I've done this with my kids, as you know, Dana. Remember, as a kid, I had snacks in here, but it seemed like you guys never really ate it.
Mhm.
But it's even those little Debbie cakes. How long do they stay in your system? That white cream,
A
I think
long
it
time.
takes months or so.
It doesn't break down.
It doesn't break down. So things like that, they really do cause you to age a little faster. The sun is good, but when you're a browner person, the melanin sites will help protect you so you don't get as much damage. However, sunscreen is very important. Treat your bodies right, do the right things, and your bodies will age at a good pace.
Excellent. That's
Mhm.
fantastic. Every one of those things that you said, I can picture in my own personal life. And, I've been applying those things, and I'm starting to see those improvements as well for myself, for the people around me, for my patients, and for my family and friends. And you kind of answered the next question that I had, which was, how do we slow down the process, or the negative effects of aging? And I think everything that you said was spot on, because a major part of it is our environment. The
Mhm.
other part sometimes is what we do. Nature versus nurture. And then there's another portion to it that's called genetics. And when we consider epigenetics, what we have found in the last 20 to 30 years is that we have much more control over our genetics than we think. We
Mhm.
may come into the world with a certain gene pattern, but that does not mean that you will express every one of your genes.
It's true.
Ask a person who has celiac trait. Ask a person who has any of these other
Yeah.
genes like sickle cell trait.
Yeah.
You do not always have to express the genes that you have. So what does that mean? That means that you're in control of a major portion of your outlook for your 100-year experience here on this earth. And so I want to
Yes.
encourage you to take some of these practical tools that Ms. Cooper Bryant is explaining to us, and to start enacting those right now, regardless of what your family situation is, regardless of what your genetics are. Only 10% of your disease expression has to do with your actual genetics.
Yes. Okay.
The rest is your environment and the things that we're doing. Okay. So be encouraged with that. There is something that you can do.
By the way, we do gene testing in my office, by the way. We do
Excellent.
genetics. So we look at
Tell
certain
us about that.
medications. Yeah, we look at it to see if certain medications are good for you or not good for you. So we do gene testing at Vita Left Infusion, and we do medical management as well. So don't be afraid to come in and tell me, hey, I got this medical problem and I need some help. I have discovered diseases like cancer, unfortunately. I have discovered that. So please understand that hormones, aging, environment, waste, toxins, lack of sleep, sedentary lifestyle, poor gut support or microbiome, uh, brain signaling, these things really do change how we age. And if you start to tune into, I want to be healthier, I want to be like the farmer that's 100 and something years old, still living, start to think about what you're doing to your body and make a change.
That's fantastic. So I want to ask you this question, as we're beginning our wrapping up. My grandfather was a pastor, and most pastors say, "I'm beginning to close." And what does that mean?
Nothing.
Nothing. Yes. So I do want to ask you, hey, so I'm doing all of the right things, Mrs. Cooper Bryant. I'm eating right. I'm sleeping right. I'm drinking clean. I'm exercising.
Mhm.
I'm paying attention to my body on an as needed basis.
Okay.
I'm observing a lot of the protocols that we've described here.
Mhm.
However, I I need, what is my sign that it's time for me to get the extra boost? Whether it's fatigue, whether it's I'm plateauing my weight loss, whether I'm plateauing in my energy. What is typically one of the first indicators that I'm going to get that says, hey, you're doing all these good things, but it's time for you to get a boost, and it's time for you to contact Mrs. Cooper Bryant?
Pain, fatigue, You know, you hear this thing called fibromyalgia, chronic fatigue syndrome. These symptoms that they have, they really do give you that indicator that you need to do something to get yourself out of the bed. The sedentary lifestyle is not a good thing. Just because you're in pain doesn't mean you sit in the bed and you don't move. You got to get out, you got to get moving. The weight bearing exercises are extremely important at joint health and bone health. So you have to get up and start moving. Um, if you're dealing with post COVID or you have some immune issue and you're just feeling weak, come and see me because the vitamins will help give you some additional support through the process. Okay.
Wow, that's awesome. And, you know, in this time, that's a very relevant topic because post COVID has become a medical diagnosis. They call it post COVID, they call it long haul COVID, whatever you call it, there's an option for you. And there may be a lot that Mrs. Cooper Bryant can do to help you get over that hump. You're doing all the other things.
Yes,
Why not try this out as well, right? All
exactly.
right. So I want to know how I can find you. I want to know how I can find you, whether it be online. Where would you like for me to look for you? Because I want to know how I can get involved with what you're doing and how I can use your services.
Okay, so we're on Instagram, we're on Facebook, we have our own website, and you can always call us at 386-336-4229 and set up an appointment. We'll come to you if you can't come into the office. We're in Flagler Beach in the Nirvana Wellness Spa. We're actually in there with two massage therapists, one chiropractor, and we have a tattooing beauty expert in our building. So we all share the same um, location, and we want to make you feel your best. It's ultimately our goal is to give you the best options for your buck.
Fantastic. Well, once again, thank you so much, Mrs. Cooper Bryant slash Mrs. Mom, for hopping on here and blessing us with this information and giving us an opportunity to make a change, to make a pivot starting now.
Yes, yes. And I thank you, son, for just taking the opportunity to go out there and share this good news and support to people because they don't know. We always go for a Tylenol or an ibuprofen, and we forget about, can we do something different? Can we get a better response without the side effects of the medication? Don't get me wrong, I prescribe all the time, but if I can do something in addition that will not be so harsh on your body, I definitely will give you that chance.
And that's something that I know most of us do need.
Mhm.
So, folks, thank you for hopping on here. This has been fantastic. Once again, Dr. Cooper with In Harmony Wellness. If you are looking for Mrs. Cooper Bryant, you will find her information here in the comments. Please do reach out if you have any questions. Please do reach out if you're ready to take the next step in your anti-aging process. Now, if you're interested in what we're doing here as well, I would be honored if you would go ahead and click that like button and click the subscribe button. I'm certain that you will find some fantastic information as you go along, and you'll continue to get notifications when we do great things like this for the community. Once again, this is Tea Talk, a comfortable place for health dialogue, presented and brought to you by In Harmony Wellness Clinic. I look forward to your success. You take care.